25 treatments, you're saying.
What's the status of your kidney cancer? They think that's cured?
It's been,
Removed. They removed the
I
kidney
mean,
and
yeah,
and the
it's been
adrenal gland.
6-7 years since it's been taken out.
Okay.
And I went for all my appointments afterwards, and everything's been fine.
Okay.
They were
Well,
monitoring some
congratulations.
things
The
are wrong.
deal is you have a 1 in 8 chance of having one cancer, you have a 1 in 64 chance of having 2 cancers, and you have a 1 in 256 chance of getting 3
Well, let's
cancers.
hope we don't have a third.
So we give you the treatment daily, 5 days a week. You know, if it's logistically problematic for you to get chemotherapy and radiation on the same day, you can skip the radiation treatment on the day that you get chemotherapy. They don't usually use cisplatin in esophageal cancer, and that's takes a long time because you have to be hydrated for it, particularly somebody, and they probably wouldn't do that use they probably wouldn't use cisplatin in somebody who just got one kidney anyway. So you may be able to take the radiation and the chemotherapy on the same day, but if it's problematic for you from a logistical standpoint, then you can skip the radiation the day you have chemotherapy. The deal on acute side effects with radiation is relatively simple. The rate of accumulation of the dose determines the development of the and how soon you develop and how severe the side effects are. So you take if you're getting chemotherapy and you take that day off the radiation, then the side effects of the radiation will be less and develop slower. That makes sense? You have any questions? Or have I explained things to your satisfaction?
This is treatable. I mean, just the radiation and the chemo will dissolve it all, right?
Well, I never know how any individual patient's going to do. And the reason why that is when I first went out in private practice, I had this patient that was morbidly obese and had diabetes, and he entered the hospital 3 times because of his diabetes, and I was treating him for a bad lung cancer, and he called me 2 years after he finished the treatment and wanted to know if it was okay with me if he went to Europe. And I thought the guy had died, but it took forever to get him through the treatment. He almost died from his diabetes, but the treatment caused him to lose weight, and when he lost weight, his diabetes improved, and then he was at less risk of dying from the diabetes. And I must have done a superb job with his lung cancer, because back then in the early 80s, only less than 15% of the patients made it to 5 years, even including the surgery-only treatment patients, because there wasn't any chemotherapy for non-small cell lung cancer back then. But now, now we have excellent medical oncologists, and there's all kind of drugs that, there's at least 100 different chemotherapy drugs that we didn't have when I first started out in private practice in radiation oncology. So, patients do better and live longer, and they develop a new drug practically every few months. So it's practically every cancer, the patients do better now than they did when I started out in practice, because the diagnostic and staging imaging is infinitely better. I mean, when I started out, they only had didn't even have CT scans. And then we had CT scans for the head and then the body, and in the 21st century got PET scans. And so we more accurately stage the disease. And now there's when I was in medical school, there weren't any medical oncologists in private practice. They were all at, except in the big city like New York, Houston, LA, San Francisco. So that so there's a tremendous shortage of oncologists when I first started out in practice. So, and there weren't that many drugs. So the medical oncologist, when I was a resident, wouldn't even see non-small cell lung cancer patients. So, we've had tremendous advances in our knowledge about cancer, but diagnosing it, staging it, and treating it because of all the improvements in medical oncology. So it's just patients just do better than they did 10 years ago. Yeah, but I basically, because of my experience with patients, I have no idea how any individual patient's going to do. Because I just treated this one lady for pancreatic adenocarcinoma, and she sailed through the treatment. She only had occasional nausea. So I'm used to patients being sick from the first week to the last week and taking a month to get over the treatment. And this woman hadn't had a bit of trouble with the treatment. So patients are amazing. Even though the human genome is only 30,000 genes, we're actually less complex than wheat. It's amazing the range of reactions that some patients tolerate the treatment great, and other patients just have problems from the first week all the way through the treatment. So it's highly variable. But I would never hazard a guess as to how any individual patient's going to do. When I took my board examination, I could, quote you statistics, because I have a very capacious memory, but, I figured out all that's pretty irrelevant to any individual patient. But women do better than men, stage for stage, cancer for cancer. We treat from 8 o'clock in the morning till we finish, and usually we usually try to finish up by 4 o'clock during the week and 3 o'clock on Fridays. So the way we accomplish that is patients that are over 70 get treatment 3 or 4 days a week when they have very favorable breast cancer. Because the traveling, the coming and going, causes them more aggravation than the treatment. So that's how much better the treatment is than it used to be.
And then how many, we were talking about them being 3 times a week, how often
Yours
a
is
week?
going to be 5 days a week unless you want to take the day of chemotherapy off, then it'll be 4 days a week. But it's going to be 25 treatments.
So for 5 weeks then?
Probably 5 weeks, maybe 6, depending on.
Okay.
So you
Okay.
cut it off. Have any questions?